Hello, this is Dr. Gil Wilshire at Missouri Fertility. Welcome to our discussion today concerning recurrent miscarriages. This is also called recurrent pregnancy loss. Recurrent pregnancy loss occurs when a woman is pregnant, she knows she's pregnant, and then for some reason the pregnancy goes away or miscarries. This usually happens in the first trimester. The definition of recurrent miscarriage has changed in the past few years. It used to be that a woman had to have 3 miscarriages in a row. The definition has been downgraded to only 2 miscarriages, and no one seems to agree if they have to be in a row or not. But certainly, in my opinion, if a woman has had 2 miscarriages, she deserves to be evaluated. Now, miscarriages can be very devastating. They're emotionally very troubling, and they affect the couple as well as the woman involved. They're not exceedingly common in my practice, but about 5% of my practice does concern recurrent pregnancy loss. Now, the causes of recurrent pregnancy losses are numerous. The most common cause of a miscarriage is abnormal embryo. An embryo can frequently have abnormal chromosomes, and about 90% of the time this is due to an abnormal egg. Sometimes it's just bad luck. Sometimes if the woman just isn't making very good eggs, and sometimes the woman is older, usually over 35 or 40, and not many good eggs are coming down the pike. So if you have an abnormal embryo, there's nothing you can do about that, unfortunately, during that particular pregnancy. Another reason for recurrent miscarriages is an abnormal uterus. If a uterus is not formed properly, and a woman is born with a funny shaped uterus with something called a septum, these can cause miscarriages, and these can be improved. There are tumors called fibroids that can affect the uterus, and these can cause miscarriages as well. There's some debate about how big a fibroid has to be and where it has to be, but in my experience, once a fibroid gets to be an inch or greater and there's no other reason for miscarriages, we like to take these tumors out and repair the uterus sooner rather than later. We can usually do these through simple, minimally invasive surgeries, so our threshold to do these surgeries is fairly low. Large polyps can also cause miscarriages, so we almost always want to do what's called a hysteroscopy to evaluate the inside of the uterus to fully evaluate the cause of recurrent miscarriages. Another cause of miscarriages is medical disease. Sometimes hormonal problems, such as a low thyroid or a too high thyroid gland, can cause miscarriages. Uncontrolled diabetes, other hormone problems can also cause miscarriages. Women with polycystic ovarian syndrome, particularly if it's not being addressed, is also associated with a higher miscarriage rate. Usually when we fix these endocrine problems, pregnancy rates normalize. Another cause for recurrent miscarriages is due to the immune system attacking the tip of the placenta as it's normally invading the uterus. These are called antiphospholipid antibodies. We also see related factors called lupus anticoagulant and some other antibodies. These can cause clotting to occur at the placenta when it's invading into the wall of the uterus, and this can cause miscarriages as well. Once we identify these problems, these too are treatable, usually with a medication called heparin and even baby aspirin in addition to that. Pregnancy is very complicated, and we don't always know the reason for miscarriage. There's many things that have to go right, and sometimes there's something that just evades detection or we just don't understand. So you have to realize that in about 1/3 of the time, we really don't know why a woman is having recurrent miscarriages. Now, I will frequently see women who have been tested for what are called coagulation problems, or something called an MTHFR mutation. A large study was done recently which showed these are not associated with recurrent miscarriages. If a woman has a family history of clotting problems, it certainly makes sense to test for these. Now, the MTHFR issue, where a woman does not activate her folic acid, is controversial. Maybe in a woman who is otherwise perfectly healthy with no problems, an MTHFR problem does not cause miscarriages. However, in my experience, it is possible if there are other issues involved, and the MTHFR causing high homocysteine levels is adding just enough to push somebody into recurrent miscarriages, does raise suspicions with me. The treatment for this issue is very simple. We give a vitamin called activated methylfolate, and it should take care of the problem very nicely. So since the treatment is easy, it's cheap, it's safe, I have no trouble treating MTHFR, but we generally don't test for it unless there's a strong reason to do so. It is hard to give a particular woman a prognosis for eventually having a successful pregnancy. In general, success is seen about 70% of the time. So in general, the prognosis is excellent. If a woman or a man has a chromosome problem and they're just not making good embryos, donor egg or donor sperm can get the good chromosomes we need to make good embryos, which should also solve the problem. Now, these issues are fairly rare, about 3% of the time, so that's generally not a problem for most people with this problem. So, recurrent miscarriages, you should not suffer with them, and after you've had two, you really deserve a full evaluation. Life is too short to be having these problems. Here at Missouri Fertility, we want you to have a healthy, successful pregnancy so you can get on with childbearing. I hope this has been helpful to you. This is Dr. Wilshire at Missouri Fertility. I hope you found this video helpful. Please like us on Facebook, subscribe to us on YouTube, and follow us on Instagram.